Hey, I'm Julie Edwards and this is Kelly Mullen. Our presentation and case study is on hypertension. Hypertension is a condition that occurs when blood flows through the blood vessels with a force greater than normal. Hypertension can strain the heart, damage the blood vessels, and increase the risk of heart attack, stroke, and death. High blood pressure is a common, chronic, ongoing health condition. High blood pressure affects adults of all ages, but mostly those over the age of 65. Around 76.4 million people in the United States have high blood pressure. According to the NGC, there are 3 stages of hypertension. Stage 1 hypertension is a blood pressure of 140/90 or higher. Stage 2 hypertension is a blood pressure of 160/100 or higher. And stage 3 is a systolic blood pressure of 180 or higher, or a diastolic blood pressure of 110 or higher. For our case study, our patient is patient J. She's a 58-year-old female real estate agent who sees her primary care provider occasionally for hypertension and allergies. She has no other significant history other than she drinks and smokes. Patient J is in the middle of a big real estate deal when she feels her head and chest pounding, lightheaded, and dizzy. Patient J drives herself to the emergency room. Upon arrival, they take her blood pressure and it's 205/100. Which stage of hypertension is patient J experiencing?
Patient J is experiencing stage 3 hypertension, which is a clinical systolic blood pressure greater than 180.
Upon assessment, we stated her blood pressure is 205/100, her heart rate's 100, her temperature is 98.6, her oxygen is 99%, and her respirations are 18. When should one intervene immediately with antihypertensive medications?
According to the guidelines from the American Heart Association, intervention with medication should be used to treat stage 3 hypertension, which the patient currently is experiencing, anything greater than 160 systolic.
Clinical guidelines for monitoring treatment of blood pressure and target rates of blood pressure. To properly monitor the response to antihypertensive medications and lifestyle modifications, use clinical blood pressure measurements. In people under the age of 80 with treated hypertension, aim for a target blood pressure of 140/90. In people over the age 80, aim for a target blood pressure of 150/90. So for patient J, the physician orders labetalol 10 milligrams IV now to monitor the patient's blood pressure, and if the first dose of labetalol doesn't work, to administer an additional dose of 10 milligrams 30 minutes later to obtain electrolyte levels, BUN and creatinine levels, and a CBC, and a urinalysis to detect hematuria and proteinuria in the urine. What would you do next? How would you evaluate the effectiveness of labetalol?
We'll continue to monitor the patient's blood pressure to assess the effectiveness of the labetalol. We will also administer, should the patient not be within the physician's parameters, we would administer the additional dose of labetalol. We'll obtain all the lab orders as ordered by the physician. We'll continue to closely monitor the patient as well.
The nursing interventions for patient J was administering labetalol, obtaining the labs, and rechecking the blood pressure, which was 190/100, and administering the additional dose of labetalol. And we will continue to monitor the blood pressure in the patient. While in the emergency room, patient J states, "I am having chest pain." What would you do next?
The first thing we would do is stay with the patient, assess the patient, notify the physician immediately of patient J's complaint of chest pain. We would await the physician's orders. At that time, we would be assessing the patient and monitoring all vital signs and waiting for further orders from the physician. The physician has given us orders to obtain a set of cardiac enzymes. We would also obtain a 12-lead EKG, and he asked us to administer 2 milligrams of morphine IV once for the pain. The nursing interventions based on this set of lab values and blood pressures, the patient now, we would obtain cardiac enzymes based on the patient's complaint of chest pain. We would obtain the EKG for the physician to read. We would administer the 2 milligrams of morphine for the patient's pain, and we will continue to monitor their blood pressure. The lab values come back. Her first troponin level is 0.01. Her CK level is 100. Her CKMB is 2. Her urinalysis came back in normal ranges. Her blood pressure is now 160/90, and her EKG shows a normal sinus rhythm. What do you think happens next? We will evaluate, well, how do we evaluate the effectiveness of the blood pressure medication and the pain medicine? And the physician's orders were to admit the patient to the hospital for further evaluation and consult a cardiologist. The patient goes to the floor of the hospital to have a cardiac workup and be seen by the cardiologist, and to continue monitoring her blood pressure, which is now 160/90. The physician's orders were to order those cardiac enzymes. They will be ordered as every 2 hours, then 6 hours after the original set from the emergency room. The patient will remain MPO after midnight for a cardiac stress test in the morning. And also we would administer Dilaudid 1 milligram every 4 hours as needed for pain, and continue to monitor the patient's vital signs every 4 hours. What do you think happens next? Patient J was MPO after midnight, so she goes for a cardiac stress test. After she completes her stress test, her results are normal. Patient has no complaints of chest pain. Her blood pressure is now 140/70. Patient J has significant risk factors for further cardiac testing. She's advised that she possibly may need a cardiac catheterization to rule out the possibility of a blockage in her heart. The patient is educated on the risk of the procedure, and she remains MPO for the cardiac catheterization. The cardiac catheterization is performed the next day via a femoral artery. The stent placement is warranted due to a blockage observed in the patient's coronary artery. The patient has been placed with a fin stop on her artery and is observed for 6 hours post-op for complications, which would be bleeding. The patient will be discharged from the hospital on new medications with a follow-up appointment with her cardiologist. Does patient J have risk factors for cardiovascular disease? As we discussed in the very beginning, the patient is under a lot of stress. The patient is also a smoker, and she is a drinker, and she is already diagnosed with hypertension. She also consumes alcohol on a regular basis. The assessment that she had in stage 2 was her blood pressure was 205/100, her heart rate was 100, her temperature was normal, her oxygen was normal, respirations were also normal. She had the multiple risk factors for heart disease, even though she did have a normal stress test. In stage 2, the interventions that would be implemented would she would be prescribed blood pressure medications. She would also receive smoking cessation. She would be educated on ways to reduce her stress, and she'd be educated on controlling her high blood pressure with diet and exercise. Under stage 3, now that the patient is diagnosed with hypertension and she had a blockage in her heart and a coronary stent placement, she's going to require regular follow-up appointments with her primary care physician as well as a cardiologist. Stent placement requires a medication regimen that she must follow very carefully in order to preserve the integrity of the stent and reduce the incident for further blockages in her heart. Hypertension also requires medication management as well as lifestyle changes to control the disease. The patient will have goals, which will be to stop smoking, reduce her stress, improve her diet, and add exercise to her routine, as well as be compliant with the new medications and keep her follow-up appointments. In stage 3, the outcomes for the patient we hope to be are that the patient will control her blood pressure with diet, exercise, and stress reduction techniques. The patient is using a smoking cessation program and a nicotine patch to help stop smoking. She's on blood pressure medications and blood thinners to maintain a normal blood pressure and to also help keep her heart stent from forming a clot. The patient now has regular follow-up appointments with her primary care physician as well as her cardiologist. Thank you.